Why do I feel a bit uncomfortable about this?
Well, I think, first of all, you know that all announcements at party conferences are often full of well, political pronouncements. And today, what we've seen is a lot of headlines of very ambitious plans, and much of this, I would say, does have some merit. There's no doubt that the world in general, not just in medicine, has moved and is continuing to move technologically and digitally. The use of AI is going to be part of our lives. But I think what we heard today was some pronouncements that didn't lacked detail, lacked issues around operational ways in which this will be achieved. But also, as you quite correctly mentioned, you'd almost assume that the future NHS is one where the digital side trumps everything else, whilst you're also correct to mention that there'll be large numbers of patients who will need to be able to access and receive care in more traditional manners, who won't be using smartphones, who won't be savvy, or who in fact who might choose just not to. And what we need to hear much more of is ensuring that we also continue to provide services for everyone, and that no one should be disadvantaged in such a system. No different from a system where often when I try and seek help for, I don't know, my broadband provider, if the only option I have is a bot or a online chat, it's going to be disadvantaging many other people. So I think we need to have these principles of equity in whatever is being proposed.
And that is the issue, isn't it? I mean, already I believe the NHS is a 2 or 3 tier service, depending on if you know how to work it, if you know how to use it, if you know what's wrong with you, if you know your rights, if you know your treatment pathway, or at least you're not happy with it and maybe you can suggest another one. So I do believe that it's already in tiers. For that reason, this will just create another one, won't it? That people will be potentially pushed into doing this kind of online consultation when they don't want to do it.
Sure. Well, look, I'm a GP. I'm a senior partner in a practice that I run alongside others. And we've made a very clear decision from the beginning that we use online tools. We offer it to patients who want to use it, but we go out of our way to make sure that no one is excluded from calling the practice to make an appointment and be given the same guidance, support. And for those who are not digitally enabled but want to be, we offer training if they want to. So I think it's important to always bear in mind that we need to look after all people. And what we didn't hear about today was how the government plans to ensure that those that may not want to use these tools are given the right support and equal access. We didn't hear about that. The other is a lot of assumptions were made today which have no evidence. So, for example, 8.5 million more patients or appointments. We don't really know whether that's actually a replacement of appointments or if it really is extra. Remember that if you are consulting with a specialist or a GP or a doctor online or a clinician, that person is then not available for other work face-to-face. So in fact, now in many GP surgeries, my own included, we're having to replace some of our face-to-face sessions with sessions where we're plowing through online consultations. So you can't be in 2 places at once. And what we haven't heard about today is the staffing implications if you really are going to be expanding another lane on the motorway, so to speak. And actually, if it's really to be an expansion, we haven't got the workforce to do that. The other is that the cost of all of this, at the moment, we're not even getting funding to get our IT up to scratch in terms of modern standards, let alone these very ambitious ideas of how we will be technologically completely enabled in an NHS where everything is a digital front door in the NHS. So I just see there's a bit of a gap between the pronouncements today and the operational reality, which we haven't heard anything about.
So the staffing issue is a really interesting one, because they have stated that there will be dedicated specialists working for this online hospital. If we just think of it as a hospital, there will be dedicated staff there. But as you say, we've already got a shortage. I think the NHS is still looking for a huge number of doctors and nurses to fill vacant positions right now. How are they going to staff from all corners of the country as well. They're saying that people can call from all corners of the country to get to speak to a specialist, when we don't have enough at the moment dividing their time between private and NHS work as it is.
You're absolutely right, Petra. And remember, the other point is that we, at the moment, are facing still several million patients on a backlog who are waiting for hip operations, cataract operations, all sorts of surgery, vascular surgery. I could go on. Now, none of those patients can be treated in an online hospital. They're patients who are going to have to go into hospital, have to be physically seen, have to be physically operated on. And so one has to be, I think, realistic about this use of the word hospital and what it can actually deliver. It's not going to be a replacement for the fact that large numbers of patients are going to need to be seen physically face to face. There's no shortcut to being examined, no shortcut to actually having a knee replacement in a hospital. You can't do that online. So the government's actually grappling with this huge backlog. It already realizes that patients are waiting 12 months or more for such procedures. It has made a promise to reduce that waiting list to about 18 weeks. That's its promise. And so I can't seem to fit the pieces together to see how we're going to be doing all of that, and the doctors who are meant to be doing that then finding time to be providing this extra lane on the motorway of online services. Now, I'm not against online and I'm not against digital tools. I think that society is moving, and in many ways you can also become more productive, more efficient. And as you said, people like yourself, I now as a GP will often be consulting with patients who may be at work, they may be away from work, or they may be traveling. And for them, such tools are really useful and really effective. And I can now see photographs of a rash and give advice. I can do a video call. But equally, I serve a large population of older patients who have mobility issues, who don't really have the ability to use smartphones in quite the same way as many of my other patients. And for them, as I said earlier, we've made a conscious decision. We need to support everyone equally. So I think what if this was a plan that made sure that the digital tools accompanied other ways of accessing and being provided care, and that was done in a way that no one was left behind, I think that'd be different. But what we're not hearing is about the other side. We're almost assuming that everyone will be forced into, or in fact, those that don't use this will be disadvantaged. I think it's really important to make sure we don't create inequities.
The other comment that I made in my talk up, Doctor, before I got to you, was that I have a certain level of medical intelligence, and I couldn't think of another way of phrasing that. But there are a lot of people who are not as in tune, perhaps, with their health. They don't perhaps know the language to use, and my worry with that is that people who are in front of a screen to somebody, an impersonal somebody, maybe they're talking about something intimate, maybe they just don't quite know the words to get round it. There's nothing like being in person with somebody to calm you down and ask the right questions. That is a concern that I have for people.
I couldn't agree with you more. As a GP, I have to say that I see the reality of what you're describing, which is I can only properly, for significant numbers of my patients, communicate effectively, understand their complaint, the context of their complaint, by the non-verbal cues, by actually being physically able to communicate with them.
Yeah.
And I think what we mustn't do in the NHS is to create obstacles from people being able to see their clinician, their GP, face to face. So it's really important. What we've heard today is a lot about how the NHS will become a digital front door. We need to have another front door open for those that don't want to use the digital front door, who actually want to have that personal contact with their healthcare professional. And for the reasons you mentioned, there are many patients who will not want to divulge issues of a personal nature in an online form.
Yeah.
They actually, and what we have in my practice, often patients will make an appointment. It'll just be a personal issue. They don't want to discuss their issues and have it triaged in advance by someone else. And I think we need to make sure that those systems of being able to be seen, continue alongside the use of digital tools, as I believe they should be in many other walks of life as well. So what we need to hear much more from the government about is that this is a tool, an important area of development, and we should also have the traditional ways of accessing your healthcare practitioner alongside. But also, I think we need to also make sure that we do enable people who want to learn how to use tools, how to use their NHS app. And that's something certainly we're doing in my practice, and many other GP practices are running now training sessions for those that feel they want to. And the other thing I've learned is that it's important not to generalize. A lot of my patients who are much older, who've not been, you could say, brought up in the digital age, actually they use WhatsApp all the time. They're fervent users of WhatsApp, and once you've actually managed to load the NHS app on, which is a challenge in itself, because you have to authenticate it, so it's not easy, but once it's been loaded onto their phones, they can actually use it quite effectively. So I've been quite surprised at how many patients, once they've been helped to load it, in fact, many of them are now being able to issue their prescriptions or request their prescriptions, whereas before they were having to come to our surgery with a piece of paper ticking the scripts they wanted. So it can become much more efficient.
Oh, yeah, I love it. I love that system when I'm running, because I have to have regular prescriptions, so it's great just to go in and tick the box. Is there a concern, Doctor, that again, I'm a very cynical person, comes with the job, that at some point in this digital future, we could see human doctors replaced with AI versions with the knowledge, but none of the humanity. Is that a worry as well, looking at the future of going digital with the NHS?
No, I do think it's a worry. I think it's a worry that it will be tempting, I think, for any government to always look at how it can, in cost terms, be as efficient as possible. And there is a difference between getting a message about looking after yourself in terms of an online information about your health. There's a big difference between that and actually having a clinician talk to you, explain to you, answer questions. We're actually seeing a lot of that in mental health these days, where people are being asked to go online to with depression. People are being asked to do CBT online using software. Now, it works for many people, but for many others, it's just not appropriate because actually it's too mechanical, and I think the system often will favor such automated ways of consulting because it actually it's cheaper, but it also doesn't require a human being to be involved. But I think you raise a really important point, and I think that it's important that as we develop policy, we must be mindful of the fact that there is, for many instances, no substitute for actually being able to have that human contact, and no automated system can replace that. And as a GP who looks after people in terms of not just the fact they've got a cough, but looks after them as a person and in the context of their lives, that context cannot be captured in a sterile digital exchange. So I think that there is value, and there are going to be people who actually don't have the time to come. They'll want to have that information. As you said, people like yourself often who know about the system can use these tools very effectively. But I totally agree that we need to guard against policymakers getting so, you could say, drawn into this idea, because what it looks like to them is being able to get more productivity. Just like when you heard earlier the announcement today, 8.5 million more appointments promised under the NHS hospital. It sounds very grand, but are these going to be proper appointments, or are these going to be simply bits of information sent to your phone, counting as a consultation?
Yeah, quite. The other thing is, of course, with health, it is very personal, and sometimes you have to deliver bad news and I presume that these online doctors will have to do the same. Where is the duty of care when it comes to delivering to somebody like you were now, if it was you delivering to me that I had cancer, for example, in this kind of setting? I just worry again. I'm concerned that it's just dehumanising the medical profession, which has to be the most human contact that we have outside of our families, right? We come to see about intimate things, about personal things, about scary things, our deepest, darkest fears we will share with a doctor. We don't do that with anybody else. And yet it feels like we're being pushed further away. Where is that duty of care? Listen, Petri, I've got to give you some bad news. I've got 2 minutes, I can do it now.
I'm agreeing with you, Petri. I think that there's no doubt that whatever we see in terms of the digital age, there are some and significant amount of proportion of what we do as healthcare professionals cannot be replaced by digital exchanges. There is no other way of breaking bad news and in a humane way other than being with that person, being able to look at them in the eye, for them to be able to look at you, express their anxieties, be able to be sensitive, see them as a human being. You can't do that at the other end of a phone. You cannot do that even, I think, on a video consultation. So we need to make sure that aspect of the way we provide care does not somehow get diminished, both in terms of volume, but also in terms of its value in its own right. Because there is a therapeutic aspect about seeing people face to face when it's appropriate and when it's needed. And when you're breaking bad news, that's a really important example you give, and something I have to deal with as a GP. And we routinely tell my staff when there's any significant medical issue, I will say, and I will actually say, I'd like the patient to be seen face to face. We get online requests from many patients who actually, there's a question that asks, how would you like to consult your GP? And many will say on the telephone, probably because they're busy. But I will often say to my staff, will you please ask them to come in? Because I know I cannot do justice to a person who's going through a difficult time, who may be depressed, on a phone call. I want to be able to see them. I want to be able to show that I'm there for them. I want to be able to understand what their concerns are. And you have to do that in a human way. And breaking bad news is a very important example.
And picking up, as you said, on those non-verbal cues, because yes. A lot of people don't know how much they're speaking through their body language, but you as a sort of a trained doctor will recognise, or a twinge that somebody hasn't mentioned because they didn't want to bother you with it. Again, that sort of diagnosis, if you like, or beginning of diagnosis will be lost.
You're absolutely right. I mean, you first of all, if you can't see someone and you can't see their facial expression, on a phone call, a person who may be depressed or feeling very anxious can conceal it just by conceal it in terms of the way they speak. But if they're right in front of you, you can actually see what they're feeling. You can relate to that. You can empathize. So I totally agree. I think one of my worries is that what we don't want is the public to somehow think that they cannot be physically seen face to face, because if they think that the NHS is now about digital contact only, they may themselves feel less likely to even stake their claim to being seen face to face. Well, I think it's so important that we do develop the technological changes that the NHS will benefit from. So I don't think there's anything wrong with that. I think it's good. And the technological changes we've seen ourselves, even as you mentioned earlier, the ability to request a prescription from your phone has made a huge difference to so many people's lives, as an example. And so we need to people being able to see the results of their tests has made a huge difference to so many who would otherwise have been anxious waiting to make an appointment to find out what the result of their blood test was. So I think, there's no doubt there's a really important role for technology. We just need to make sure that we don't politicize it to the point where it seems to be presented as some solution to everything in the NHS. Even this word, the NHS Online Hospital. Yeah. It's a pretty loaded title, and it gives people the impression that somehow we're going to be able to replace normal hospitals with this other way of caring for people. That's not quite correct, and so I just think we need to do this in a wise, measured way, certainly develop technology, but at the same time retain the irreplaceable element of human contact and the fact that we as doctors and nurses will always need to be able to see people face to face, see them in the way we've always seen them, and many of them will need physical treatments that cannot be treated over a online tool. So as long as, that's my plea to politicians, have balance in the way we're approaching this, so that we can meaningfully use technology alongside the skill set we have in the way we manage patients physically.
God, I hope they're listening. Dr. Chaand, it's been an absolute pleasure. Thank you very much indeed. Dr. Chaand Nagpaul there, GP and former chair of the British Medical Association. Quick break, back in a second.